and had about a third of their capacity. So there was a need for clarity. The information minister gave that clarity within a day or two of the president's address. Here's what he said.
A lot of the recent positive cases can be traced to social gatherings. These are people who go to events, first of all, wearing their masks, their temperature is taken, sanitizer is used, and then at some point in the event, they will sit down for food and drinks and take off their mask and start chatting and engaging, and droplets will be flying from somebody's mouth onto somebody's, plate or whatever, and will be floating around, and before you realize, people are getting cross-infected. That is the reason for which social gatherings of that nature have been banned. So, for example, you'll notice that the president did not ban burial services, because the activity of burial, we actually encourage you go on, so that you don't have people's mortal remains, piling up in the morgues, etc. The activity of burial, so the burial service, the one where you take the body, most likely to a church, and a prayer is said before they will go and do the actual burial, that one is not banned. It is only limited to about 25 persons. So a private burial or a private burial service is not banned. What is banned is the funeral, where typically in the Ghanaian community, we will all gather, you see a long line, shaking of hands, announcement of people, then they'll call for a song, people will come and dance, then there's lunch or dinner, food and drinks, alcohol. There's a little party associated with it. That is what in Ghana typically we refer to as a funeral. That is what is banned, because it is that aspect that we notice that there's that high risk, and therefore people are being traced to similar activities that have caused spread.
So this is the information minister speaking about a day or two after the president addressed the nation on the 31st of January, where he banned funerals, weddings, and other events. So that's the clarity that was given to us at the time. Now let's hear the president last night with what he calls the enhanced measures.
The COVID-19 task force, which I chair, has recommended that a second look be taken at the protocols that have been put in place for social and public gatherings, in particular weddings and funerals across the country. I have in previous updates emphasized the need for the strict observance of safety protocols at all such gatherings. To ensure that such gatherings do not become the sources of infections, the following must be adhered to by all at these gatherings. Firstly, the wearing of masks continues to be mandatory, and persons must respect the enhanced hygiene protocols. Secondly, all such events must be held in open-air spaces. Thirdly, the duration of such events is limited to 2 hours. Fourthly, there must be observance of the 1 meter social distancing rule. And fifthly, handshakes must be avoided. Furthermore, given that people sitting together to eat, drink, laugh, dance, and talk in large gatherings without masks are the riskiest activities for spreading the virus, all post-event receptions, particularly related to weddings and funerals, are banned.
Right, there you go. So that's what the president said last night. Do you see, do you hear what I hear? I wonder what the difference is between the funeral-related activities that are supposed to happen in open spaces now and what he describes as the reception after the funeral or wedding. I wonder what the difference is. But anyway, let's come to our guest. We'll come back to settle this matter later. But at the moment, it's not clear which particular aspects of funerals or weddings remain banned and which ones can now happen in open spaces. Let's go back to our guests and seek some clarity on our own actions in light of the president's address. Dr. Kofi Boni and Nana Kofi Kwache, again, thank you both for your time. If it's okay, I'd like to.
Thank you too.
Yes, if it's okay, I'd like to start with you, Dr. Boni. Now, it's clear now we're in a third wave of a far more dangerous strain than what we had to begin with. After hearing the president, do you see clarity in terms of our way forward? Do you feel like now every Ghanaian knows what to do and that we will indeed be safer?
Thank you very much, Kojo, for the opportunity once again. Yes, I think the president was very clear on what the measures that we need to take and also the tools that we have already, that we started this engaging in this some time back. But it looks like people are now beginning to maybe forget about some of these things or some of the tools or the measures that were in place. Look, when the WHO, or let's say the scientists around the world, talks about the Delta variant as a variant of concern, what they simply mean is that it is so because of its high transmissibility. And we have in this country established that even from the 1st of July, right until now, from the communique that the Noguchi brought out a while ago, seeing that we are seeing a lot of cases which we were not seeing before. And these cases, if you look at the people, because they are basically doing the walk-in. In other words, most of them are traveling. So they walk in and you see them, they are not sick. But the moment they come and they test, they turn out to be positive. We have had instances where people have challenged us that the results we are giving to them is not for them because they don't think they are positive. There have been instances where we have to retake these samples and test them again. And the same, or the result that we get is consistent. That is with the previous one. So what the president said is right on point in the sense that we need to enforce the measures that we had, the protocols that we started maybe seriously tackling at the beginning of all this pandemic, and also more or less maybe put some punitive actions to it. So those who are not going by it, they should be more or less be punished. If we do that, then we'll see it to be serious. Look, we are in the university here, University of Ghana, and there are some students walking around who think that all this that we are doing, this COVID communication that we are sending across is all maybe not true. They still don't believe it. But look, if the thing is not close to you, if a relative of yours or you yourself have not gone through it, sometimes you may have doubts. So if we continue to do this education, we intensify our education and also follow what the president is saying, I think we'll have a breathing space. I mean, in some let's say a few months to come. Because now we are having issues with people not believing what is going on and also just not following the protocols. They are just disregarding what we had initially, what we were doing initially. So, I mean, that's what I'll say as a way of introduction to your question, that we should really take what the president says serious.
Right. Now, give us a bit of information. You know, you've picked up on all of these cases coming through, Noguchi. For those who have been vaccinated, because you have had some of those vaccinated testing positive, have you had any of those hospitalized or having a need to be hospitalized because of their symptoms?
See, what Noguchi does is when we do the test and we give out the results, now the result is given to the individual by email.
Right.
But the same results will get to the district health director, that is within the locality where the individual stays. So they call the individual and follow up. So Noguchi will not know whether these individuals got hospitalized or not. So the moment we give the results out, National Health Service also gets that information through a system that we call the SORMAS. So they will follow up, and with that individual, first they will do contact tracing. Then, if the individual becomes severely ill, they'll follow up. If there's hospitalization, they follow up. So for us, it will be difficult for us to know whether these individuals who tested positive were later hospitalized or not.
Right. Okay, let me bring in Nana at this point, and I'm interested in the idea of attitude and how to change attitudes. That's what's needed at this point, since we all seem to have dropped our guard or let our guard down, as the president said. Now, looking at the information that is out there, the education that is going on, the enforcement, and the direction from leadership, I wonder whether you would say that we have enough going on to ensure attitude change. Nana, this is for you.
Yeah. So as we said elsewhere, when it comes to these COVID-19 measures, the kind of outcome variable you're looking at for health system, for pandemic public health response, apart from just new infections and hospitalization and transmission rates, is to look at how that translates into the medical system. So how does that translate into ICU capacity? How does that translate into healthcare worker availability? How does that translate into what we say we want to see in a medical setting, which is the stuff they need, the space they need to function, and the staff they need to actually man the area. Do we have enough to deal with the levels of infection that are coming in? That's the outcome measure that is really important there. So when we are looking at everything else that's going on, that's really what we are trying to do, so that people who end up getting severely ill or critically ill will get the care they need in time. What that means is that our public health interventions in an environment where vaccine coverage is very limited have to work. And that means that we have to communicate to the public in a way that folks understand that this is serious. That requires, I think, from public health authorities, more candid conversation and more timely conversations when adverse facts become obvious. I think it's important to give consistent guidance to the public about what's going on, because understandably, a lot of pandemic fatigue has set in. And a lot of people, like Dr. Bonnie is saying, still do not have a complete, understanding of the existence of COVID-19 or the risk it can pose to people, not just as a question of live or die, but survive with long COVID, etc. Those are things that I think are not very clear to the general public. I think some of that is the difficulty of doing this kind of public health communication in an environment, in a media environment where there's a lot of online misinformation and fake news and conspiracy theories. But I think that there has to be, a determined effort on the part of our public health authorities to contend with that. And I think that could mean trying to explore other models of risk communication that include maybe doing more aggressive work online, because that's where the misinformation starts before it jumps into traditional media. And like I said earlier, just doing the public health comm stuff candidly and in a timely manner. For example, we know that we got the first confirmation of the Delta variant in our communities, or community spread, on July 1, I believe. I think the first confirmation that we had picked up cases at the airport, that came around June 23rd. But if you go back and look at Noguchi's statement, they actually say that the first sample of the Delta variant was identified here in April. So if we are talking then about risk communication, it has to do with also communicating those kind of things in a timely manner, so people understand that the variables perhaps have changed, that even if we don't know that there is certainly community spread, there's reason to be extra cautious, and doing that in a timely manner and consistently, so people have an accurate perception of the risk in real time.
Right, thanks for that. Now, I wonder, having prescribed, such a strategy, would you say you can see that? Can you see that happening in Ghana already?
Well, I mean, I always describe, when you're dealing with COVID-19 as like sailing a battleship. Those things don't turn around easy. So from the time you decide that you need to change course, you still have a long way to go to fully, change the direction of the ship or turn it around. What that means is that, obviously to this point, even after we got the notification about Delta variant and all those things, I think objectively, if you're looking at the general public, the behavior isn't changing significantly. It's not responding to the risk in the way that we would have hoped. So the prayer is that now that the president has come and actually acknowledged that we're in a third wave, as we have been in for the last 4 weeks, that there will be some concerted, understanding in the public that, okay, this is serious now. So we actually have to take all these things seriously. But I think also some of the things that we want to see done have to do with more than just saying them. There has to be some critical follow-up, a meaningful follow-up, again, from public health authorities. Because, for example, if we say workplaces are high-risk environments for the spread of COVID-19, that's true because a lot of workplaces, formal workplaces, are air-conditioned, poorly ventilated. Mask wearing might not be at the best. But what kind of protocols have actually been given to workplaces about what do you do, for example, if one of your colleagues tests positive? Do you know who to call? Do you know how long isolation has to be? Do you know who has to go into quarantine? When has that guidance been given? So we want to make sure that we are doing that stuff too at the same time. But I mean, generally speaking, if we are looking at just compliance right now, I don't think we're going to see change. It obviously has not changed in the last 2 or 3 weeks since we knew about the Delta variant. And I don't think it's going to change immediately. But part of that has to also do with their commitment to enforcement. We have to see, I live pretty close to Suan Laboni. Every weekend since we heard about Delta variant, I can hear the clubs and bars from my apartment. So we know that those things have to be enforced because there are many police districts and many checkpoints in Suan Laboni, and these things are still happening. So we need to see that kind of concerted enforcement that will give people the understanding that, we're not playing here. We're not in a position where we can afford to be lax with our enforcement regime, because if we do not get it right, there's nothing special or mystical about Ghana that prevents what happened in South Africa or Uganda or Sierra Leone from happening here, apart from our concerted effort to avoid it. So if we don't do well at that by being disciplined as a public, by being committed and focused as leadership, then the inevitable outcomes will play out.
But Kofi, so let me just get your thoughts on this. So we're talking about compliance. What's the science behind deciding to ease restrictions at the time when you say there's a third wave and there's a Delta variant, which is deadlier than what we have seen so far?
Well, I think you're referring to what Kojo was teeing up earlier with regards to the change in semantics from January to now. I think, again, I actually think some clarity would be great there with from the Ministry of Information maybe about what we're talking about again, because it sounded to me like what we are trying to do is go back to what we were doing last year, March, April, May, June, where we had only burials allowed. I'm not sure if that's exactly, I'm not understanding entirely well, but if it's only burials allowed, then we actually kind of, it's going towards in the positive direction. But I think like I said earlier, we have to titrate all these things to the reality in the hospitals and the reality in the front lines. So if you have healthcare workers in the Ghana Medical Association saying that, from our point of view, the availability of critical and intensive care is increasingly limited and is dwindling at a very fast rate, then I think what you want to do as your first move is to put in the most restrictive measure you can afford to do as a means to slow down the spread immediately, so that then you can start looking at, okay, now that we've brought down hospital admissions, now that we've brought down ICU admissions, what are the things we can do to figure out how, maybe beyond burials, other kind of funeral activities can happen. But I think for now, we really have to be limiting these social gatherings very, very clearly. I think we should be going back to a kind of the regime that we actually had right after the lockdown, where it's very small family burials. Because the reality is that we don't have enough of a reach through law enforcement to monitor all the funerals that happen in Ghana in a weekend. And if there's a setting where we say 200 people, 300 people can gather for a funeral, for a burial, I think we have to be honest in our minds that the way our culture is, the way society is, it's unlike people will sit down, they'll have a drink, that kind of stuff will happen. So I think it's a question of kind of communicating that it's burials only, and being clear about that. But that's something, again, that I might be wrong on in my interpretation of it. But I understood it to mean that we are going back to kind of a burials-only regime. And I hope that's the case. And same thing with the weddings, that we are doing ceremony only, none of the social gatherings, none of the receptions. But I think that's why we have to have, I think when you say there's a time restriction, that's obviously a good thing, but it has to be clear that it's not a time restriction for sitting down and saying that that's not a reception because there are no tables. It should be clear that it's really about, the burial and the service around that, or the wedding and the service around that, and then really nothing else.
So the president was very categorical that you can have funerals, but post-event receptions where people drink, where people eat, is banned. On the 31st of January, when he was banning funerals, he was also categorical and said funerals, weddings are banned. This looks like a bit of an easing of the restriction. And that's why I sought to find out from you whether, based on where we have gotten to and based on the fact that the president says we should go back to the tried and tested, system that we used in the past, whether this would be the right approach to dealing with it.
Well, I think that part of that is basically the question of, I think recently we've also had some comment, I think from the Presidential Advisor on Health and the Ghana Health Service DG, that that funerals are a big part of our cultural setup, so we don't want to eliminate those entirely. And I think if indeed we're saying that it's not just burials, but funerals with limits, I think that's what that might be reflecting. But again, obviously, that is not as restrictive as what we had before, where it was burials only. And like I said earlier, I think that's what we have to go back to in the short term, so that we can at least stem the bleeding and then reassess over time. So if indeed it's the case that we are we're actually saying that it's funerals but with limits rather than just burials only, then yes, relative to January, it should be a less restrictive situation. I think that's fair to say. But I really, really do think that we have to right now be focused on absolutely aggressive mitigation of the spread. So in the short term, I don't think we should be giving room for that. I think we should be saying, just go back to burials only, go back to ceremonies only, no parties, no sitting down, nothing. And then, 3-4 weeks from now, when we have a better sense of how those are impacting spread, we can reassess. But I don't think a system that says funerals with restrictions is exactly what we are looking for. I think what we want is burials only.
Okay, I want to bring back Doc on this one. And I have in front of me the statement that Noguchi issued over the weekend, where a lot of information was given about the discovery of the Delta variant in many of the tests that have been done. I'm quoting the report. It says the positive cases have very high viral loads, indicated by the low cutoff cycle threshold, CT values, obtained in the real-time RT-PCR assay. The CT values for the majority are between 15 to 20, compared to higher values above 30 seen previously. So now the cutoff value is lower, which means that the viral load is higher. Okay, I'll continue. It has also been observed that the positive individuals are taking longer to clear the virus. This is evident in the number of retests that still test positive. Okay. Now, Doc, I think the obvious thing here is that this variant spreads easier. So if somebody coughs, that one droplet will contain far more of the virus than the alpha strain or any of the other strains that we were dealing with before. This one has more. So if that droplet falls on you, or you end up inhaling it or ingesting it or whatever, getting it into your system, chances of you getting sick are much, much higher than before. Now let's put this alongside the restrictions. In the past, funerals were banned. By funerals being banned, that meant the actual service, the funeral rites were banned. You can have a burial service in church, sticking to the church protocols, which said that you can have up to 30% of the church's capacity socially distanced. And then, of course, you could have the private burial with 25 people. That's what prevailed until last night. From last night onwards, the understanding from the president is that you can now hold funeral-related events in an open space as long as the distancing is 1 meter. There's no restriction on the numbers as long as the distancing is 1 meter. For the old strain, we were working with a distance of 1 meter. Scientifically, for the new strain, should we also be working with a distance of 1 meter and no restrictions on numbers?
All right, Kojo, thank you. I think that is one aspect of what he said. I like the bit where you were talking about what we would call social mixing, or let's say increased social mobility. If you have funerals, yes, you have individuals being closer together. But I think the president emphasized on the fact that we should still keep that distance. Yes, 1 meter is enough. 1 meter is enough if you are wearing your mask and wearing it properly. And that should be considered. So if you said, okay, keep a distance apart, 1 meter apart, and you keep on your mask, don't take it off. That is very important, because during funerals, especially when you're having a funeral service, there will be singing and all that. So if you are wearing your mask, it does two things. If you are infected, you will limit the spread. Then also, if you are limiting the spread, that means whatever is coming out of your mouth will contain the virus, that is if you are infected. But because you are wearing the mask, it is warding off the number of aerosols that you are passing out. Yes, so in virology, what we say is that the amount of inoculum, in other words, the amount of virus particles that will be in the aerosol that you will inhale, that is when you are exposed, also matters. You can take in some. If it is not enough, you will not get the infection. That is, you become exposed, all right, but you may not get infection. So if I'm wearing the mask, that you are limiting the spread of the amount of inoculum that will come out of your mouth, the amount of aerosol that will come out of your mouth for other people to inhale. Then if you are keeping that distance of 1 meter, that is enough. Whatever it is, though it may linger for some time, it will drop. But so if you are further off, that means you are likely not getting that one inhaled into your system. So that is what I think has to be emphasized. Right. When you talk about the issue of eating or having the post-event, maybe receptions and other things being banned, I think it's a very important point. What that means is that usually when we are eating, we have to take off the mask. And because we are mixing up with people that we may know, though we are eating, we'll also be talking. And that is where we get it easily transferred or transmitted to others. And we are talking about a virus or a variant that you may have it, but you may not know that you have it because you don't have obvious symptoms that shows that you have it. So that that reception and other things that have been banned, I think is very important. But what is more important is making sure that the measures that were put in place, we have to adhere to them. I think that is more important than any other thing that we have to do, in terms of the restrictions that he talked about.
Right. So I'm interested in this because, as we understand, with the old variants, even with the 1 meter and the masks, people were still getting it.
Right.
So now if you have a more virulent variant, which spreads easier, why are we saying scientifically that the same 1 meter and masks is enough when it wasn't even enough for the old variant?
Yes, see, with the old variant, we have what is called the number of people who get infected when they become exposed from an individual who is confirmed positive.
Do you mean the R0 figure?
Exactly. Okay. So for the Alpha variant, we were talking about 1 or 2 to 3 people, even if you are wearing masks and you are keeping the distance. So what you are saying is true. Maybe we can widen the distance, because for the Delta, we are talking about 7 to 8 people getting infected from somebody who has been confirmed positive.
So instead of 1 to 2, we have 7 to 8.
Yes.
Right.
For the Delta. Whereas the Alpha, we're having like 2 to 3.
2 to 3, okay.
Yes. So you see, certainly we have an increased number of people who will get exposed. The exposure is certainly different from infection. You get exposed, and certainly most of them will turn out to be infected. That will mean that we'll have higher number of hospitalizations, and will mean that we may have deaths from that. So yes, now we'll have more people being exposed, getting infected. Then hospitalizations follow, then death. But the point is that, are you asking whether the distance is enough? 1 meter, I think for science has clearly stated that 1 meter is enough. But if you look at what is happening now, I will even go for maybe a little bit of maybe 2 meters will do. Make sure that you keep further away from the person, and also making sure that your mask is properly worn. That's what I can say about it.
Would you recommend that adjustment in the
measures we have
in the communication from leadership?
Well, the president has got experts and maybe scientists who have been advising. So I'll leave that one for the
You're
policy.
An expert. You're a scientist, and we're asking you.
Oh yes, yeah. For me, I mean, from my opinion, would be that let's even widen the distance.
Right.
If it is 1 meter for the alpha, let's do it 1.5 or 2 meters. Now that we are dealing with a highly transmissible variant.
All right. This is the Super Morning Show on Joy 99.7 FM. I want to say a quick good morning and welcome to those of you who have tuned in from Kumasi. Thank you so much for joining us on Love FM, particularly you, Mr. Ebo Sam, who is listening avidly. All right. So we're going to take a few messages. When we come back, we'll get back into it with our guests. Nana Kofi Kwache is a health systems and policy researcher, and Dr. Kofi Boni is a senior research fellow at Noguchi. More from them when we return.
Whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. Our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which, according to the World Health Organization, has increased transmissibility rates, and in our case in Ghana, has led in recent weeks to a rise in hospitalization and ICU bed uptakes, and tragically, deaths. Indeed, in update number 25, the last date I rendered on 16th May, our total active case count stood at 1,314, with our daily infection rate standing at 100. 1,121,168 tests had been conducted, of which 92,460 persons had been infected. 91,146 persons had recovered, with a total of 783 deaths. Since that update, the situation improved significantly, whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. Our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which, according to the World Health Organization, has increased transmissibility rates, and in our case in Ghana, has led in recent weeks to a rise in hospitalization and ICU bed uptakes, and tragically, deaths. Indeed, in update number 25, the last date I rendered on 16th May, our total active case count stood at 1,314, with our daily infection rate standing at 100. 1,121,168 tests had been conducted, of which 92,460 persons had been infected. 91,146 persons had recovered, with a total of 783 deaths. Since that update, the situation improved significantly, whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. Our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which, according to the World Health Organization, has increased transmissibility rates, and in our case in Ghana, has led in recent weeks to a rise in hospitalization and ICU bed uptakes, and tragically, deaths. Indeed, in update number 25, the last date I rendered on 16th May, our total active case count stood at 1,314, with our daily infection rate standing at 100. 1,121,168 tests had been conducted, of which 92,460 persons had been infected. 91,146 persons had recovered, with a total of 783 deaths. Since that update, the situation improved significantly, whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. Our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which, according to the World Health Organization, has increased transmissibility rates, and in our case in Ghana, has led in recent weeks to a rise in hospitalization and ICU bed uptakes, and tragically, deaths. Indeed, in update number 25, the last date I rendered on 16th May, our total active case count stood at 1,314, with our daily infection rate standing at 100. 1,121,168 tests had been conducted, of which 92,460 persons had been infected. 91,146 persons had recovered, with a total of 783 deaths. Since that update, the situation improved significantly, whereby in June, our active cases stood at some 1,200. Our daily infection rate fell to 50 cases and recorded 10 deaths in the whole of the month. Our nation, like many others, is experiencing a third wave of COVID-19 infections. These increased infections have largely been driven by the Delta variant of the virus, which, according to the World Health Organization...
Welcome back. It's the Super Morning Show on Joy. Our guest as we talk about COVID-19, Dr. Kofi Boni is a senior research fellow at Noguchi. Nana Kofi Kwache is a health systems and policy researcher and PhD candidate at NYU School of Global Public Health. Okay, here's how I want us to wrap things up. I'll start with you, Dr. Boni. So, the president, in addition to many things, announces that there will now be an institution to develop vaccines. Let me ask you this. What would you expect that institution to get involved in? And can it do anything in time to help us with our current predicament with COVID?
Okay, so what the first part of the question, what I expect that institute to be involved in, I think the president in his speech enumerated a lot of them, about 5 or 6 of them, and those were spot on. But the second part of the question is, I mean, whether we will be on time in developing the vaccine, I will say that no, because it depends on how long we'll go with this pandemic. That is one. And two, we have to note that vaccine development does not come up overnight. You cannot start and finish within a short time. Vaccines have to go through several trials before it comes out finally and to be certified for public use. So for the second part, that's what I can say. We don't know how far this pandemic that we are dealing with now will take us. Right. So developing vaccines now to tackle what we have may not be, it may not be within our reach. But like we are doing now, we can cooperate with other institutions that has already been certified and are into vaccine production to get what get what they have for public use. We have to note that our coverage and our vaccine coverage in this country is woefully inadequate. What we have now is not good enough. That is why we are reinforcing, or we have been asked to reinforce the measures that we currently have. So that is what I can say to the question.
Nana, the reality is that almost 99% of our population has not yet been vaccinated. Almost 99%. Now, in the president's address, there were no dates given for the arrival of the next batch of vaccines. It would appear that even the ones that we are expecting, we are relying on the charity of others. It is not in our control whether or when we will get vaccines. So bearing that in mind, and bearing in mind the fact that no society can actually expect to physically distance themselves long enough for this virus to die out. No matter what, it will spread among the population unless something more permanent like herd immunity is achieved. So if we cannot rely on herd immunity, at least not in the near future, then are we not really playing a futile game? How effective can any manner of social distancing or measures be for a virus like this?
Well, the science of COVID-19 tells us that the basic, restrictions or protocols that are in place or that are recommended, physical distancing, mask wearing, hand hygiene, and ventilating spaces, those are sufficient to deal or to tamp down any resurgence of the pandemic at any point. We know also that the better your risk communication is, the more consistent it is, the more candid it is, the more timely it is, the less likely you have those resurgences in the first place. So there are layers of things we can do to reduce those risks, a priori. I think we also should be aware that, yes, the vaccines, we are at the mercy right now of much of the rest of the world in terms of their donations and then manufacturer scale up. But we do have some short-term timelines that are at least give us some weeks. So that, for example, next week, the African Union is shipping out about 60 million doses of the Johnson & Johnson vaccine. 6 million doses of the Johnson & Johnson vaccine. Ghana is supposed to receive about 400,000 of those. We know that starting in early August, the USA will also be shipping the first of its 60 million doses of Pfizer vaccines. And they have said that they're going to do kind of general equitable distribution for the first round around the continent, just to make sure that the universally low vaccine coverage rates can come up a bit. So that we are starting to see some movement on the vaccine front, which are what we know are confirmed deliveries that are supposed to be coming in the next 3 or 4 weeks. Those will get us, those are not enough by any means to get us to, like Dr. Bonnie was saying, any kind of meaningful level of vaccine coverage. That's the reality. So in the short term, we have the protocols. And the reality here is that yes, the restrictions are difficult. They are big, inconveniences in our lives. But we have to look at this as a question of what are we going to permit in our country? Are we going to have a scenario where we say, well, this is hard, so we're not going to do it, and what may come may come, when we can see what that means in Rwanda, we can see what it means in Uganda, we can see what it means in South Africa. Or are we going to say, these things are difficult, so let's communicate that they're difficult and how long we have to do that for? Because I think part of the fatigue for people comes with, if you say, okay, we just have to do this for 1 month, we do it for a while, 3 months later, we have to do it again. The cycles begin to weigh on people. So I think giving people a clear prognosis, for example, saying that it's not the case that we are going to get 70 million Johnson & Johnson vaccines this year. That's not going to happen. It's not the case that we're going to get, 10 million Pfizer this year. That's not going to happen. We are looking at timelines that play out all the way to the end of next year. So if that's the case, then communicate to employers that when we talk about, maybe virtual working, physical distance in the workplace, it's not a thing you can stop in 3 months. It's something you have to think about as, going all the way to the end of next year. And when we talk about, schools and changing schedules there and shift systems at the universities, etc., communicating that to them as well. I think if people are giving a clear indication that this is not going to be some short-term, quick and done, one and done kind of thing, and that it actually is going to require us to be doing this response consistently and committedly over a long period of time, then you at least get some general public sentiment that this is not the kind of thing where we just get up and say, okay, mission accomplished, and then 3 months later again, we're in a problem. Making it clear that mission accomplished means vaccine coverage at 80+%, and until we get there, the game is still on. I think that's really important.
Right. I want to thank you very much. Nana Kofi Kwache is a health systems and policy researcher and a PhD candidate at NYU's School of Global Public Health. You also heard from Dr. Kofi Boni, who's a senior research fellow at Noguchi Memorial Institute for Medical Research. Gentlemen, thank you both very much for your time.
Thank you for having us.
Yeah, it's still the Super Morning Show on Joy 99.7 FM, and when we come back,
homosexuality is not a fundamental human right. Show me anywhere in the 1992 Constitution where it says that a sexual preference is a fundamental human right. The laws of Ghana are clear. I challenge anybody, any lawyer in this country, to show me where in the 1992 Constitution it says that sexual preferences are a fundamental human right. Homosexuality is a sexual preference. It is not a fundamental human right. And that is why this law, for the first time, in Section 5 and Section 22 of the bill we put before Parliament, are actually criminalizing, for the first time, actions of violence against persons. We call it extrajudicial treatment.
Super Morning Show.
Right, yes, so when we come back, we deal with that and more, the LGBTQ plus law. We examine the contents. Who does this law affect? Who does it protect? Whose rights does it defend? Whose rights does it remove? Who are those in favor? Who are those against it? What will Ghana look like with such a law in place? We seek answers to these and more when we return.